If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Gastroesophageal reflux disease, or GERD. Your esophagus is the tube that carries food from your mouth to your stomach. Gastroesophageal reflux disease, GERD, happens when a muscle at the end of your esophagus does not close properly. This allows stomach contents to leak back, or reflux, into the esophagus and irritate it. You may feel a burning in the chest or throat called heartburn. Sometimes, you can taste stomach fluid in the back of the mouth. If you have these symptoms more than twice a week, you may have GERD. You can also have GERD without having heartburn. Your symptoms could include a dry cough, asthma symptoms, or trouble swallowing. If you have nighttime acid reflux, you might also experience chronic cough, laryngitis, new or worsening asthma, and disrupted sleep. Anyone, including infants and children, can have GERD. If not treated, it can lead to more serious health problems. Causes: GERD is caused by frequent acid reflux. When you swallow, a circular band of muscle around the bottom of your esophagus, the lower esophageal sphincter, relaxes to allow food and liquid to flow into your stomach. Then the sphincter closes again. If the sphincter relaxes abnormally or weakens, stomach acid can flow back up into your esophagus. This constant backwash of acid irritates the lining of your esophagus, often causing it to become inflamed. Risk factors. Conditions that can increase your risk of GERD include obesity, bulging of the top of the stomach up into the diaphragm, called a hiatal hernia, pregnancy, connective tissue disorders such as scleroderma, and delayed stomach emptying. Factors that can aggravate acid reflux include smoking, eating large meals or eating late at night, eating certain trigger foods such as fatty or fried foods, drinking certain beverages such as alcohol or coffee, and taking certain medications such as aspirin. Complications. Over time, chronic inflammation in your esophagus can cause narrowing of the esophagus, called esophageal stricture. Damage to the lower esophagus from stomach acid causes scar tissue to form. The scar tissue narrows the food pathway, leading to problems with swallowing. An open sore in the esophagus, called an esophageal ulcer. Stomach acid can wear away tissue in the esophagus, causing an open sore to form. An esophageal ulcer can bleed, cause pain, and make swallowing difficult. And precancerous changes to the esophagus, called Barrett's esophagus. Damage from acid can cause changes in the tissue lining the lower esophagus. These changes are associated with an increased risk of esophageal cancer. When to see a doctor. Seek immediate medical care if you have chest pain, especially if you also have shortness of breath, or jaw or arm pain. These may be signs and symptoms of a heart attack. Make an appointment with your doctor if you experience severe or frequent GERD symptoms. And take over-the-counter medications for heartburn more than twice a week. Treatment. Many people can improve their symptoms by avoiding alcohol and spicy, fatty or acidic foods that trigger heartburn, eating smaller meals, not eating close to bedtime, losing weight if needed, and wearing loose-fitting clothes. In some cases, you might need medicines or surgery. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.